Hi guys, it's Hassan here, and this video I want to cover the introduction to NDIS, specifically for allied health professionals, although not exclusively. This might benefit others as well. So this video is really tailored, and this presentation is really tailored for people that might be considering doing NDIS, or maybe already offering some services within the NDIS, but would like to understand the scheme a little bit better. So I've been in this space for a little while now, but it baffles me and it amazes me that a lot of healthcare professionals still don't really understand what is the NDIS, what's the opportunity that is available to them, and how does it all work. So I thought I'd cover some of that, and really this is a resource that hopefully I can then refer people back to. All right, so what are we going to talk about? Quick overview. I'll talk about what is the NDIS as a scheme, how the funding works, how the plans work, because that's really the heart of the NDIS. I also want to talk about some key terms and stakeholders that are involved, and then a quick note on progress reports. Become very important, particularly for, again, allied health professionals that are delivering services to NDIS participants. As always, guys, there will be timestamps in the description below if you want to jump ahead or just go to a particular point. But first, you might be wondering, who am I? And why am I doing this presentation? So, as I said, my name is Hassan Qureshi. I'm an exercise physiologist. I practice here in Sydney, Australia. I also have a clinic, and I'm a business owner, and that is, providing NDIS services through Western Sydney. Okay, here's an image of the clinic located in Wentworthville. We provide exercise physiology services as well as physiotherapy services, both in clinic and at home across Western Sydney as well. So again, as I said, because I've been in this space for a little while, I get questions about the NDIS quite frequently. I'd say every week I'm having some sort of conversation around this, around the concepts that I'll be covering. So I thought I'd summarize that in this video. So first of all, what is the NDIS? Obviously, we know that it's an Australian scheme. It stands for the National Disability Insurance Scheme. It's a government initiative designed to help provide support and services. That becomes a key term, support and services to people with permanent and significant disabilities. And that's the clients within the NDIS are referred to as participants. Okay, it's I will talk about what we mean by permanent and significant. No. So quickly, what does it mean by permanent and significant? As you'll realize that sometimes we have injuries that cause a level of disability. For example, if somebody's just broken a bone, they can no longer, let's say, broken a wrist, they can't write with that hand, they can't do a lot of things with that hand. So it becomes a kind of disability, but it's not permanent, right? The bones will heal and the person will most likely go back to normal function. So as opposed to somebody who's had an amputation, for example, right? And so if their wrist has been amputated, or their foot has been amputated, that's pretty much a permanent disability. That's not going to grow back, right? But also, it has to be significant. So, for example, some people have a hearing loss, or even amputations. You could have amputated a small, like a pinky or one of the toes, and so it doesn't cause a significant disability, and that probably won't qualify. So, people within the NDIS have disabilities, but they're also permanent and significant. The NDIS as a scheme helps these participants to achieve their goals. So the goals are very important within the NDIS, and we'll talk about that in terms of what they look like in the plan, etc. But it's funding to help these clients or help these participants achieve their goals, and they might include things like greater independence, community involvement, education, employment, and improved well-being. Essentially, it's helping these clients or these participants overcome their disabilities or the challenges. So essentially, it's helping these participants overcome the challenges that come with the disability, and then still be integrating and getting involved with the community as best as they can. What's also important here is that the NDIS is not funding treatment necessarily. So if somebody has a particular disability, the NDIS is not funding you as an allied health professional to treat, i.e. fix that problem. It's more to build their capacity and to help them achieve their goals despite their disability, if that makes sense. So what are some features of the NDIS? Again, this is more from a perspective of if you're a business owner or even an allied health professional considering NDIS, as opposed to some of the other schemes, or perhaps in light of some of the other schemes that we work with, such as Medicare, work cover, private health insurance, etc. So within the NDIS, the funding is personalized and it's based on the individual's needs. So at least in theory, if a person has a more significant disability, then they get more funding based on that, okay? Which is good because if you compare that to the current ways the aged care works, with the home care packages, two people on level 4 package, may have very different needs, but they're both getting the same amount of funding effectively. Whereas with the NDIS, at least, the funding is based on the need. And so it could increase or decrease, of course, based on that person's needs. Within the NDIS, there's also flexibility in how the funds are used, as long as they're what they call reasonable and necessary, but there is an amount of flexibility. So for example, somebody who has funding for a particular service, let's say hydrotherapy to improve their balance, as an example, may, based on the therapist's advice and consultation, may then use that funding in a different setting, for example, right, in a clinic or in the home environment, right? So that's just one example of how the funds are flexible. They're not sort of set in stone, so to speak, okay? The other benefit of the NDIS is that the focus is on long-term goals and outcomes. Again, as I mentioned, it's not treating the participant, it's helping them increase their capacity, but also the focus on long-term means that you're really working with these clients over a long period of time. Again, if we compare that to something like Medicare, sometimes clients come through with an EPC referral of 3 visits, and then you don't see them after that. Whereas with NDIS participants, their disability isn't going away, and so they need time and they need your assistance to work with them over a long period of time, which means you can build that rapport. It means you can get greater clinical outcomes or interventions. You can plan accordingly over a longer period of time. There's an emphasis on participant choice and control, which is again a great thing because it means if you're doing a great job, then the participants will stick around. Of course, it means if you're not doing a great job, they have the choice and control to leave and go somewhere else. But again, that gives the flexibility for the participants to really use their funding in the best way that they see fit. Okay, again, so the funding is annual, which again refers to the focus on long-term, for example. So once you've, for example, signed up a new client and you know that, okay, the plan is going to be renewing in 12 months' time, then you can pretty much plan your services accordingly, right? So you can say, right, I'll see them weekly for the next 6 months, and then I'll see them fortnightly, and you can schedule that in. Again, that helps from a scheduling perspective, but also helps from a intervention perspective. You can plan your intervention accordingly. Whereas some of the other schemes is a bit more chopping and changing. You're not sure after my next cycle of 8 visits whether I'll have another approval or not. That obviously changes how you approach the rehab or the interventions, I suppose. And that, of course, can change how you approach your treatments. So who are some of the participants within this scheme? The scheme is specifically for people under 65. Of course, as we know, over 65, there is My Aged Care in Australia. And so you could possibly be working with anyone from 0 up to 65. 0 to 7 is what they call early intervention. Talked about My Aged Care. Again, as I said earlier, the disability is permanent and significant, but that could mean physical. So things like multiple sclerosis, stroke, amputations, spinal cord injuries, and the list goes on. So these are all examples of physical disabilities, but there's also a lot of psychosocial disabilities, things like autism and schizophrenia, bipolar, etc. So in other words, there's no apparent disability, there's no visible disability, but the person still has a permanent and significant disability through the mental health. And if you're wondering, here's a quick distribution graph or some data to demonstrate the distribution. On the x-axis there, you can see the different disabilities. And if you look at some of the tall towers, you will notice that there tend to be psychosocial disabilities, tend to be more predominant. So for example, autism there is the highest prevalence, followed perhaps by intellectual disability, followed by developmental delay, followed by psychosocial disability as an umbrella term. And if you look at some of the physical disabilities, things like cerebral palsy, things like multiple sclerosis, things that I perhaps, especially for those who are physical therapists, so physiotherapists, exercise physiologists, occupational therapists, perhaps these are things that come to mind when we think of disabilities. They're actually less prevalent, but of course, they are still there as well. All right, so let's get to the crux of the matter in terms of NDIS funding. So there's different categories. So NDIS participants are allocated funding based on their needs, as I said earlier, but that funding will be allocated to one of three categories, right? So there's what we call core supports, there's capacity building, and then there's capital. Okay, so core essentially helps them with everyday tasks, things like consumables, even things like domestic assistance, helping them get showers and that kind of stuff, daily tasks. Capacity building is helping them improve their capacity. And this is a presentation I put together for some exercise physiologists, and I just made a note of the two different categories that exercise physiologists can provide services under, both improved health and well-being and improved daily living. And so here, this is where allied health professionals will generally, this is their domain, is helping the clients build their capacity, again, both physically, but also in a mental capacity as well, to be able to meet their goals. And capital, obviously, is, as the name suggests, to buy things, assistive technologies, for example, to help support them. And that could be things like braces, AFOs, etc. In terms of now how the fund's managed, so there's three ways, again, that the funds could be managed. So the fund management could be by the agency, which is basically NDIA, right? Or it could be plan managed, or it could be self-managed. So what does that mean exactly? So what that means is, as a provider, if I support a participant with under the NDIS, how am I going to get my money, right? How am I going to get the money from the NDIS? So if they're self-managed, then I just issue the invoice directly to the client, or the client pays through my FPOS or cash or whatever. I then send them the invoice, and then they deal with the NDIS on their end, right? As far as I'm concerned, they're paying me, right? So if they're plan managed, then I basically issue the invoice to the plan manager, right? And then they will claim from the NDIS, and then they will pay me accordingly. And of course, if they are NDIA managed, then I will bill NDIA directly, which is the agency. A stands for agency. The little asterisk there, you'll note that the agency managed clients can only be seen by registered providers. Okay. All right, so here's an example of when we're talking about funding, how do you know how much you can charge? Well, there's a price guide, and this comes out pretty much every year. In fact, I think multiple times a year, and this will tell you the maximum rates that you can charge per hour, for example. So here's a list of professionals and how much they can charge per hour, based also on your location. So if you're in a remote location or a rural location, your rates will be a little bit higher, as opposed to if you are in the metropolitan areas. So again, this is the maximum that you can charge per hour. You can charge less than that, of course, but you cannot charge more than that. Around this time, people tend to ask the question, well, should I register? That's a very common question that comes up. Should you register as an NDIS provider or not? Well, again, as I said earlier, the providers don't have to be registered to provide services to NDIS participants, but NDIA clients or NDIA participants can only be seen by registered providers. Okay, and of course, some services, for example, accommodation services, require registration for all participants. In other words, all providers that provide that particular service need to be registered. But the key point here is that there's three types of funding or fund management: self-managed, NDIA managed, and plan managed. And only one of those categories is one that you need to be registered for. So it begs the question, well, okay, what's the distribution? So I put together a little pie chart based on the most recent report that I could find. And you'll see there that the vast majority of clients are actually not NDIA managed. So they're either plan managed, which is actually the majority there, or they're self-managed. And so a small minority are NDIA managed, for which you have to be registered. So if I was looking at that, thinking, do I want to jump through all the hoops and hurdles to become a registered provider, given that I will have access to another additional 10% or 9% of participants? I would probably lean towards not having to register, especially when you're getting started. If you're going to get started as a provider, you don't have to be registered to get started. And so, you can pretty much commence services. If once you're in the scheme, once you're supporting participants, you're getting a lot of inquiries from agency managed clients and you're having to turn them away, then you might reconsider that registration. Of course, within that, I will say, side note, a lot of providers will then work with registered providers and do a brokerage or a subcontracting arrangement, so they can still support those clients, but just through a different company. So there's a little workaround for that as well. So if you're starting out wondering, hey, I want to get into NDIS, should I register? My advice would be probably not. You can start within the NDIS without being registered. So let's talk about some of the key stakeholders, some key terms, I suppose, or key people that you should know about within the scheme. Now, this is not an exhaustive list by any means, but these are some terms that will come up frequently, and it's probably a good idea that you've got your head around these terms. So, plan nominee. First of all, so now not all participants are going to have capacity to make decisions for themselves. And so they'll have either a parent or a guardian who they've nominated to make decisions on their behalf. So that's a plan nominee. A support coordinator. Now, this is the person responsible or assigned with helping the participant find the supports that they need, right? So, as the name suggests, so they're sort of usually they're in the center of the whole sort of how the plan is being executed, and they're helping the participant find the appropriate providers, get those service agreements signed, and get those services commenced. A local area coordinator. So this is the person that sort of helps to draft the plan in the first place. Oftentimes the second and third get confused. The LAC does not necessarily help the participant find providers. They actually help the participant create the plan. So they sort of sit down with them, understand what are your needs, what are your goals, and then how much funding do you need. Once the plan has been created, the support coordinator, the SC, will then work with the participant to use those funds. Essentially. Plan manager, again, as I said earlier, is the person who will, you send the invoices to. They're managing the funds for participants. Of course, not all participants will have a plan manager, but for those who do, they're the people that are responsible for managing those funds. Support workers, very common within the NDIS. So these are people that will help usually transport your participants to and from appointments. Usually they take them out to cafes or shops or wherever they want to go. Provider. So now usually when people say provider, technically anyone that provides services within the NDIS is a provider, right? And that could be anyone from your cleaner to your physio to your support coordinator, right? But generally speaking, when the participants use the term provider, they're referring to sort of the bigger agency or the big company that usually is providing their supports. So they might have a physio coming through the provider kind of thing, or they might have nursing staff coming through the provider, right? Carers, look, there's different types of carers within the NDIS. There's what we call informal supports. And informal supports refers to family and friends, people that are not necessarily paid to be there, but they're kind of going to be there anyway. So these, again, maybe siblings, maybe children of the participant, family or guardians, right? And then there's people that are paid to support that client or to care for that person. And these are more formal supports. And again, this may refer to support workers or domestic assistance workers. And oftentimes, I've just said nurse there in quotation marks because participants may refer to their carers as nurses, but of course, they're not technically always nurses. So just be careful if you are having that conversation to say, my nurse said this, it may not actually mean that they're a nurse in a formal, accreditation perspective. All right, some other key terms within the NDIS. So SIL. So this is a type of support that the participants are provided within their accommodation. I'll let you go through the full table. SDA is a term I mentioned earlier. It refers to specialist disability accommodation. So this is a particular house that has been fit out in an appropriate way for NDIS participants. May include things like hoists or ramps and things like that. Core supports here, so I'm just explaining those terms we covered earlier. Funding categories in the NDIS for assistance with daily living activities. So things like, so it could include things like transport and also consumables as well. Capacity building, as I said earlier, this is really the crux for us as allied health professionals. It's aimed at building the participants' independence skills, including support coordination, etc., and also various therapies. That's the key term there. Capital supports is funding for the participants to purchase equipment or even home modifications, and so really buying things that help them to live a better life, I suppose. So let me do that again. So capital supports is funding for them to buy stuff, for example, or home modifications can be included. So purchases for to help the participant achieve their goals. And within that could be things like assistive technology. So that could be things like aids, mobility aids, communication devices, certain iPads, that are fit out for people with speech impediments and things like that. More recently, I've been seeing a lot of sort of gaming technology as well could be included in this assistive technology if you're into that kind of stuff. All right, so now we're going to talk about the plan. So now we're going to talk about the NDIS plan. Now this is really important because essentially this lays out how the funding works and how the participant can use those funds. So it becomes a really important document in the NDIS journey. The NDIS plan is a personalized support plan designed to meet the unique needs and goals of a participant, and it includes the following. A brief participant profile, so that'll be things like, my name is such and such, and I live here, and I live with these people, and here's what I like to do for a living, or here's what I do for fun. More importantly, their goals. Well, not more importantly, but the goals are very important. So that'll be things like I need support or I need physical therapy for improving my. The goal might be, and we'll get into what the goals might look like. So then there's a little table for funding in terms of the breakdown for the different categories that I mentioned earlier between core, capacity building, and capital. And also there's some proposed supports and services. So the local area coordinator is sort of making an attempt to see, okay, well, for these goals, what I think would be the best way for this funding to be used. I say they're proposed because that's not necessarily set in stone. And as long as it's reasonable and necessary, those things can be changed, of course, with appropriate consultation with the participants, their family, support coordinators, etc. So the plan is typically written by NDIS planners or local area coordinators, but in collaboration with with the participants, their families, and the carers. And here, especially for the renewals, and not the first plan, but for follow-ups and stuff, the reports that you will write, the NDIS reports, are going to be very important as part of that process. So now I'm going to show you an example of a plan, or what a plan looks like in the NDIS, so you have a bit of an idea. Now you may not actually have access to a participant's actual plan. That really depends on them. If they're comfortable sharing that with you, sometimes they'll share parts of it. But here's what it typically will look like, okay? So you can see here on the left is the first page. I won't go through all the details here, but on the right is my profile bit that I was talking about. And then here's the goals section. So usually it's broken down into sort of short-term, medium-term, long-term goals. So there'll be the actual goals up the top, and then a breakdown of how that will be achieved and who's going to be helping me with that. So for example, if we look at the fourth one, I want to build my strength, mobility, stamina, and communication skills. Well, the LAC and the support coordinator will help to support me, to connect me to providers, that will help me reach that goal. Okay, cool. All right, so then there's a section here on funding types. Again, we've already covered this, so we won't go through this again, but there's the different types of funding officially, kind of how it's explained. All right, so here for this particular participant, here is the total funds being allocated for this 1 year. So you can see from 2018 to 2019 Feb, this person's got about $94,015 and 93 cents. And here on the right, you can see how it's broken down. So the core supports the $72,700 out of the 94, and then the capacity building total is about 22,500, and then of course there might be some left over for capital as well. So here's an example of what this plan would look like. All right, so last little bit is progress reports. They're very important within the NDIS. You'll frequently be requested to write one up towards the end of the plan period. And so it's an essential document are essential to document and communicate the participants' progress towards their goals, and also to request and justify future funding. So think about this. If a participant's been coming to you for the last 12 months, right? They're working with you one-on-one in your clinic or their home or at the park or whatever. Nobody else besides you and the participant knows what's been happening at those sessions. So you could have been sitting around talking all day, or you could be making the most significant therapy that the world has ever seen. But the only way for the world to find out is how you document and sort of communicate that. So the document becomes really important. So here are some brief guidelines on how we tend to write our progress reports at Holistic Exercise Physiology. We'll start with the sort of same layout as the plan itself. So a little about me section, a brief description of the participant, including the nature of the disability and a little bit of their social history. I think that's really important. So where they live and what they like to do for fun. And then what I tend to do is I take each of the goals that are relevant for exercise physiology, and then I'll document the goal, and then I'll write about how exercise physiology, because that's the key service that we're typically delivering, will or is benefiting or is helping this participant achieve that goal. It's a good idea to summarize the supports provided. Now, of course, this section here could be above the goals if you wanted to, but a brief summary of what actually supports have been provided. So this could be things like, how frequent are the sessions? Where are the sessions? Are they at home? Are they in the clinic? What does a typical session look like? So again, things that if somebody was to read this document, they would have an idea of what's been going on in terms of this particular therapy, right? It's a good idea to discuss the barriers and strategies within that treatment cycle or period. And it's okay to mention things that, hey, look, there's a barrier here, there's an issue that we're facing, a challenge that we're facing. We haven't quite figured it out, but we're working towards it. We're making some headway. Because the reality is that working with people with disability, you're going to face barriers, you're going to face challenges. And if you can communicate that, you're aware of them and you're dealing with them, then that's usually a good sign. And of course, who doesn't like to talk about success stories? So if there's a barrier that you had faced and you came up with a solution and now things are working wonderfully well, then that's fantastic. You can obviously mention that as well. And then it's always a good idea to write about what future supports you're recommending, and then perhaps why, a little rationale. And as I've been the advice the advice that has been given to me is always to provide a table rather than in paragraphs. So at the end, if a support coordinator or a LAC just wants to flick to the last page because they're looking for a table, well then the table should be there. So that's it, guys. Hopefully that was beneficial for you guys. If you've learned something, please do go ahead and like this video. I would really appreciate that. And it tells me that this content is actually useful to people. If you have any questions, just put them down in the comments below, and I'll try and get to them as soon as I can. Alternatively, you can reach out to me via email and just email me any questions that you may have. And yeah, happy to connect with anyone that has any questions, either on LinkedIn or, again, as I said, in the comment section below. And if you found this useful and you know someone that also might find it useful, then I'd really appreciate if you can just share that with them, because I think the more people that we have, the more good providers that we have within the NDIS, the more we can help these participants. There's certainly a huge need to have good providers within the NDIS network. So that's it, guys. That's it from me. Stay safe, and I'll see you next time.